Okay, I would like to record a review about pancreas, and I'm going to start from the last slide. So, acute pancreatitis means that we're going to have a destruction in the pancreas that's going to be starting in the ducts. That means that trypsin, which needs to be activated, so we have trypsinogen transforms in trypsin initially inside the ducts where it's not supposed to be activated. Okay? And we're going to be seeing also in a patient with acute pancreatitis systemic inflammatory responses because some other enzymes like phospholipase circulates around the body and can produce consequences like shortness of breath and also respiratory failure, acute failure, because it interferes with surfactant. The surfactant is located in the alveolus. Okay? With respect of chronic pancreatitis disease, the origin of the pathogenesis has to do with activation of enzymes inside the pancreatic gland, but also because we have an impairment of bicarbonate secretion. Okay. Also, a patient with chronic pancreatitis has history, that means of other acute pancreatitis before, and it's chronic. It's a long time disorder. Okay. Pancreas cancer, usually when it's diagnosed, it's very late for the patient. 20% of those has been the cause. The etiology is tobacco, smoking, and 90% of carcinomas come from the ducts of the pancreas, and they are adenocarcinoma. Okay, so let's go a little bit back, and this is going to be very short but concise. We do have risk factors that are related with causes, etiologies for acute pancreatitis. So we have alcohol use, the presence of gallstones that can cause acute gallstone pancreatitis, or if the patient has hypertriglyceridemia, or abuse of steroid drugs, mumps virus, can be a scorpion stink, or a trauma from the ERCP procedure. We have a lot of etiologies, right? Cause number one for chronic pancreatitis, on the other hand, you need to think about alcohol abuse, okay? So it's not one drink, it's a long time drinking, and drinking, heavy drinking. Okay. Chronic pancreatitis has something that it is important to look for. We have calcifications in the pancreas, okay? Do we have any other possible causes of chronic pancreatitis? Yes. It could be genetic, it could be autoimmune, it could be caused by a tumor. Okay, let's go here. Pathophysiology of acute pancreatitis has to do with the presence of calcium concentration in the acinos or the intra-acinos. That is the important step number 1 to activate trypsinogen into trypsin. Okay, and that's what I want you to keep that in mind. We're going to have a cascade of inflammatory events that are going to be responsible for systemic manifestations, right? And the other one I want you to keep in mind is that phospholipase will circulate systemically and will produce lung damage because it interferes with the surfactant and it will produce respiratory failure. So pancreas also produces lipase and other enzymes. So if we have lipase, the cells that produce lipase are damaged, they're not going to be producing the function of absorbing fatty acids, right? So the release by damaged cells break down triglycerides into free fatty acids that can bind to calcium, right? So in an acute pancreatitis, we're going to be seeing an autodigestion caused by enzymes. That autodigestion, it's going to cause an inside inflammation of the acinos, and it could cause also hemorrhage. A persistent several times episode of an acute pancreatitis can cause a chronic inflammation in the pancreas, and it can also impair not only the exocrine functions but also the endocrine functions of pancreas. Okay. In chronic pancreatitis, also we're going to have a calcium elevation that will result in trypsin activation. And at the end, we're going to have a damage and the presence of calcification inside. There is an image in chronic pancreatitis that I'm sure you're going to see in radiology, that it's called the chain of lake sign. And it's like you're going to see like the distortion of all the inside ductal system. That gives you that appearance when we use contrast in CT scan. So the difference between chronic pancreatitis in a kid or in children's versus adults is that usually chronic pancreatitis in kids, it's due to a mutation in the CFTR gene that causes cystic fibrosis. Chronic pancreatitis in adults, usually we should ask ourselves about other causes like tumors, trauma, and first of all, alcohol. So they're different etiology depending on the age. One thing that is important is risk factors for each one of the pathologies in pancreas. Right now, I'm going to insist a little bit about risk factors for pancreatic cancer, which 20% of those is caused by tobacco. The other thing is being older than 55-year-old. We have two comorbidities like diabetes and obesity, and the other disorders are chronic pancreatitis, infections with Helicobacter pylori, having cirrhosis in the liver, exposure to any chemicals, being male, being ethnicity of African American, and possible risk factors are family history. Other possible risk factors are some syndromes like Lynch syndromes, Peutz-Jeghers syndrome, von Hippel syndromes, or men. syndromes, or coffee consumption, alcohol consumption, red meat consumption, or soft drinks, 2 or more per day. But those are possible, okay? The ones that I want you to keep in mind are the ones that are listed here. They don't have an asterisk, okay? The one that has an asterisk are possible. Okay. What is the pathophysiology under pancreatic cancer? Well, first of all, the location, most of them, 2/3 of them are located on the head. 1/3 of the rest are located or on the body or on the tail. Pathophysiology or genesis, the origin is genetic. So, and the genetic patterns are taken into account to target the therapy, and they're located in the ducts, and there are adenocarcinomas. So, mutations in some oncogenes on tumor suppression genes, they have mutations, and we start with metaplasia, dysplasia, and then a tumor. And that's it. That's all I wanted to tell you. So this is the third review.